So welcome everyone on the 12 months progress report. My name is Martyin, and my PhD topic is New Insights into the Application of Teledermatology. I'm a medical doctor and a PhD student at the Department of Dermatology, Semmelweis University. And my vision is that the latest technological improvements should be implemented in patient care as soon as possible. Therefore, we are working on providing reliable data to facilitate the widespread use of teledermatology. I currently have two ongoing projects. The first one is comparing the diagnostic accuracy of teledermatology systems to face-to-face examination in the diagnosis of skin diseases through a systematic review and meta-analysis. Skin diseases affect a significant portion of the global population, with a shocking 3 billion people in the world lacking appropriate care. Access to dermatological services varies widely across regions, as seen in the number of dermatologists per 100,000 people. This number is 7 in Germany, 3.4 in the USA, and a mere 0.7 in Indonesia. The cost of a conventional face-to-face visit averages around $300, while teledermatology visits cost significantly less, approximately $40. In light of these factors, teledermatology stands out as a crucial tool in facilitating timely and affordable care worldwide, yet there is still data missing regarding its reliability in the everyday practice. Most common form of teledermatology is the direct store and forward method, where the patient directly contacts the dermatologist, and this connection is separated by time and space. Our question is whether teledermatology systems are as reliable as face-to-face examination in the diagnosis of skin disorders. The intervention is diagnosis made with teledermatology systems, which is compared to diagnosis made during face-to-face examination, and the outcome of interest is diagnostic accuracy. Our hypothesis is that teledermatology systems have non-inferior diagnostic accuracy to face-to-face examinations. We conducted a systematic search, and after the selection process, we ended up with more than 200 eligible articles. In this first slide, I would like to show you the results of our first analysis. We investigated the proportion of diagnostic agreement between teledermatology and in-person examination in case of general skin disorders. On the slide, you can see two forest plots. On the left side, there is the detailed one, and the right side is a summary for better comprehension. The diagnostic agreement means the proportion of the same diagnosis in teledermatology and in-person examination, and it can range from 0%, which means complete disagreement, to 100%, which means complete agreement. Our first subgroup analysis is based on the intervention method. In case of the store and forward method, the proportion of diagnostic agreement was found to be 75%, which means that in 75% of the cases, the diagnosis was found to be the same in both the teledermatology and the in-person examination. This number is 73% in case of real-time and 85% in case of the hybrid method. These results prove that all three of these methods are equally reliable and are acceptable for diagnosis of general skin conditions, and also that the cheapest, most available form, which is store and forward, is as reliable as the other methods. However, the hybrid method tends to be the most accurate, as it is the best modeling of an in-person examination. On the next slide, you can see the same subgrouping based on the intervention method, but in the skin cancer population, where the store and forward type of intervention method, the diagnostic agreement was found to be 76%, and in case of the real time, it was found to be 65%. This means that also in this patient population, both of these methods are equally reliable. In the next slide, you can see the general skin condition patient population with our second subgrouping, which is based on the use of dermoscopy. Dermoscopy is a non-invasive imaging method which allows the visualization of colors and microstructures of the skin that are not visible to the naked eye. As you can see, in the group where the dermoscopy was applied, the proportion of diagnostic agreement was found to be 81%, while in case of lesions diagnosed without dermoscopy, this number was found to be 74%. This means that the diagnosis is also acceptable without the use of dermoscopy in the general skin condition group. The definitive strength of our study is that it is going to be the first comprehensive meta-analysis investigating all types of teledermatology care with a very large sample size and data from all around the world, so our results will be more generalizable. However, the challenge lies in the diverse study settings and the different reporting of outcomes. Based on our results, we can conclude that teledermatology is suitable for the remote diagnosis of general skin conditions. Both intervention platforms are equally acceptable. However, hybrid methods tends to be the most accurate, and it is not necessary to use dermoscopy in the diagnosis of general skin conditions. Therefore, our implication for practice would be that the implementation of teledermatology systems to patient care would increase accessibility, even in low-resource settings, as the cheapest method, store and forward, is equally acceptable as the other methods. Also, teledermatology is acceptable and reliable even if the referring patient or general practitioner does not have a dermoscope available, making teledermatology more available to more users around the world. Implication for research would be that standardized reporting of outcomes are needed, and reporting of true positive, true negative, false positive, and false negative values would be important to enable more accurate statistical analysis. Here you can see the first project progress, and let me jump to my second project, which is investigating the diagnostic accuracy of artificial intelligence systems in the diagnosis of skin diseases through a systematic review and meta-analysis. As I'm sure you know that one of the most discussed advancements of modern technology at the moment is artificial intelligence, and a very important aspect of AI-assisted decision-making in dermatology is the use of these systems in primary care, as 65% of all patients with dermatological problems only consult their general practitioner, so they are in need for real-time diagnostic support, which AI can provide. AI may not only be useful in primary care, but it may also assist specialists and reduce the waiting times. Our aim is to determine the reliability of artificial intelligence systems and determine their role in the everyday practice. Our clinical question is whether artificial intelligence systems are suitable for making a diagnosis in patients with suspected skin cancer. We use the PEERT framework. The intervention is AI. The reference test is the gold standard diagnosis made by a human, and the diagnosis of interest is skin cancer. Our hypothesis is that artificial intelligence systems have non-inferior diagnostic accuracy to dermatologists. The clinical implication would be the implementation of artificial intelligence-assisted systems to improve patient care. We are currently checking if this project is feasible. So in summary, I have currently 2 ongoing projects. The first one is investigating the use of teledermatology, and the second one is investigating the use of AI in the field of dermatology. Thank you for your kind attention, and I would like to say goodbye with the words of Marie Curie: nothing in life is to be feared, it is only to be understood. Thank you.
In the first project, you mentioned that hybrid method was the best. Is that statistically, you can claim that it's the best, or it seems that it may be the best?
I said that it tends to be the best because it's not statistically significant, as we only have a few articles in which they use this hybrid form.
So maybe if it would be powered more, then maybe it would be significant.
Yes, yes, it could be.
So, and in the second part of that project, you said that dermatoscopy is not making it better for general dermatology, right? When you say general dermatology, what does it mean exactly? No tumors?
It means that in any kind of dermatological disease, as these articles didn't make any exclusions.
So including potentially skin cancer
Yes.
as well. So, and how confident are you that dermoscopy is not required then? So I have two questions. One, do you think statistically that was sufficient to claim this? And second, if you would do the same analysis in live visits, would you see the same thing?
How do you mean in live visits?
So if I would see you directly as a patient, and if I would use dermoscopy or not, so no teledermatoscopy involved, would it be similar or would it be different?
I think that most of these teledermatology systems are used for screening. So if they see any problematic lesion, then they are going to send it to histopathology. So I think that these methods are suitable for screening without the use of dermoscopy.
I see. And if you would see it in live, if you would do the same statistics live, do you think you would see a difference? Like dermoscopy use versus no use, would it make a difference in diagnosis accuracy in general dermatology?
I think there may be a difference, but I'm not sure.
Okay. Thank you.
Congratulations for your presentation. Based on the results, where do you see the place of teledermatology in clinical practice, or is it already used?
I think that the place of teledermatology is maybe in low-resource settings, for example, in third-world countries, where it is in use currently, and it works pretty well based on the articles I read. And also, it was also available to the public in Hungary during the COVID-19 pandemic, and it was also a very successful project.
Okay, and is it currently available?
Currently, it is only available in private services, private practice.
Okay, thank you.
Thank you very much.